Hi, my name is Andrew Yu, and I am a Gastroenterology Fellow. My co-authors are Dr. Rahul Gazza, an emergency medicine resident, and Dr. Mary Flynn, a transplant hepatologist. We are all doctors from the Emory University School of Medicine. Our goal is to highlight some of the main points about hepatorenal syndrome type 1, or HRS1, and how it affects the patient. So what is hepatorenal syndrome type 1? It is a serious, life-threatening, rapidly progressing kidney failure in someone with advanced liver disease and otherwise normal kidneys. Why does it happen? Well, when a patient has advanced liver disease, they can develop changes to the blood vessels that cause them to dilate, which then result in poor blood flow to the kidneys. This impacts the function of the kidneys, essentially making them dehydrated. This is important because HRS is common and deadly. This happens in 8% of patients with ascites or abdominal swelling from liver disease, and almost 40% in 5 years. If untreated, up to 80% of patients can die. There are some risks patients need to be aware of. Infection is by far the most common cause. Alcohol and drugs can make the liver sicker and more prone to HRS. Finally, any cause that makes you lose too much fluid, such as a GI bleed, excessive diarrhea, or a large volume paracentesis without albumin, can lead to HRS. How can we treat it? Well, first, doctors are going to look for any underlying cause and treat it. Oftentimes, we will start antibiotics to treat an infection. Next, there are some medications to combat the changes to the blood vessels that lead to this kidney injury, such as albumin, midodrine, and octreotide. Sometimes, patients may need dialysis to support the kidneys. Ultimately, a liver transplant is the treatment of choice. So what can you do as the patient to prevent this? Unfortunately, there is no medication to prevent this from happening. But the best thing you can do is to keep a close relationship with your liver specialist. Also, if you feel something wrong or have a fever, seek medical care immediately to prevent this and catch it early. Thank you.